Also, major de- major depressive disorder usually has a feeling of snowballing downward in a downward spiral, and people that usually have this feeling feel as if it's out of their control, and because of such feeling, thoughts of suicide often occur. Um, they occur in it. They can occur at any point during or after a major depressive episode. Um, major depressive major depressive disorder occurs when there are transmitter imbalances, inadequate serotonin and norepinephrine inactivity. Um, Major depressive disorder is often overlooked, and diagnoses are often made as something more minor. So the percentage of people that usually have it is really known as a rare case. So the 12-month prevalence in the 18 to 29 age group is 3 times greater than in the individuals 60 years and older. Um, MDD is also more common among poor or less fortunate than people of wealth, and I guess that has a lot to do with the factor of worrying. When you're wealthy, it's not many things that you have to worry about in terms of being unwealthy when there are a million and one different things you have to worry about due to financial stability. Um, Furthermore, women suffer from major depressive disorder about twice as often as males. Research shows that the gender difference for depression may be due to biological differences. The sex hormones, estrogen and testosterone, have different effects on the neurotransmitters involved in the mood. Um, the primary emotion for women is sadness, while the primary emotion for men is usually anger, or is also paired with irritability. So, a woman being depressed will be seen as depression, whereas a man being depressed will be seen as, anger or general frustration, which often causes the misdiagnosis of, actually having a major depression disorder. Um, Machine as such. Um, However, because women are more likely than men to seek help, almost certainly contributes to the gender difference in the clinical prevalence rates for depression. Treatment for major depressive disorder varies depending on severity, but two of the most common treatments will be antidepressant drug or what's the word? I can't think of the word. Um, Cognitive behavioral therapy. SSRI is usually the first choice prescribed during massive depressive disorder. It's usually the first drug, the go-to drug prescribed. The following drug prescribed is a typical antidepressant. That's usually prescribed at for late night hours because it is a sedative. Um, and then you have the cognitive behavioral therapy. Is often used for treatment for MDD by giving a number of different sessions for effective treatment of depression. Um, if you believe you might actually be suffering from MDD, you can always go online and take the depression screening test at um, psych psychcentral.com/quizzes/depquiz.htm, or seek out your nearest doctor and request a depression screening. So that was my presentation on um, major depressive disorder. Bye.